forward to this computer. And we have one more person, perfect. Okay. All right, so we're going to go ahead and get started. Good morning, everyone. My name is Nico Nelson. I am the Public Health Outreach Coordinator here at the Texas Center for Disability Studies and also the Texas Technology Access Program. We are under the School of Social Work at the University of Texas at Austin. And today I'm going to be bringing a pretty awesome topic to y'all. You probably know a little bit about it. It's been kind of around all of our lives, or not all of our lives, but at least in the last 5 years or so. We've heard about it, but maybe we haven't engaged in it. It's telehealth. And the beauty of telehealth, I think, is it can be accessed anywhere. And I will go ahead and share my slides. Okay. Sound. All right. Can everyone see my slides?
Yes.
Yes, we can see him, Nico.
Thank you.
Yes.
All right. So again, yes, my name is Nico Nelson. I have my master's in public health. That is my contact information. You can reach me by my office phone as well. So yeah, today's presentation is Telehealth 101, Empowering Providers. Yesterday, I had my patient's PowerPoint, and if you would like to see that presentation, you're most welcome to it. That one's mostly geared at patients and trying to get them set up for telehealth, but it all works together. It's always an ongoing dialogue and conversation between the patient and the provider. So both this, some of the information in this presentation today is mirrored in the patient presentation, but that's only because I want to be very encompassing with this presentation and not skimp on anything. Some things might be maybe somewhat obvious to you, maybe not. I don't know all the levels and capacities of everyone here today, so I'm just going to go ahead and do a blanketed presentation about all the benefits, the barriers, and where telehealth is going and where it was and where it's going in the future. So, and I have you from 10 a.m. to 11:30 today, but I'm hoping to finish up at 11 and then try to get y'all out of here at an earlier time and try to be mindful of everyone's day, because it is Friday. So happy Friday. These are our contacts and disclosures. I'm not going to go into these, but you're most welcome to once I distribute the slides to you. I'm going to move on. So this is the Texas Technology Access Program. This is a little bit about us. Our mission is to increase access for people with disabilities to assistive technology so that it provides them more control over their immediate environments and enhance the ability to function independently. I've also included the website, the hot link, and also it's spelled out. So please take a look at it whenever you can. So the learning objectives for today, I'm hoping by the end of this session, we all are able to create a plan for implementing telehealth best practices, list 3 accessible, inclusive telehealth features, and then finally identify up to 5 items needed for a telehealth visit. Some being apps, devices, software, equipment, and more. So questions for the chat, and if you want to come off mic, you're most welcome to. I welcome that whenever and any time. If you have a question, please don't feel afraid to come off mic. Engage me whenever. So the first question I have is, do you know when telehealth was first used? It's something that we kind of, at least personally, became aware of during the pandemic, and I think a lot of people did. But telehealth has been used before, and I'm just wondering, when do you think that was? Next question, do you have any patients that have utilized assistive technology at all? Some of them may have not, maybe you haven't been exposed to assistive technology yet before. We're going to talk about that as well. Third question is, have any of your patients utilized AT with telehealth? So if you do know about assistive technology, have you engaged in telehealth at the same time? Have your patients done both? And then finally, what's one thing you wish you knew more about AT or telehealth? Or it could be both. So getting to the first question, So the beginnings of telehealth kind of started around the 1940s. There was images that were sent 24 miles between two townships, and that was done via a telephone line. And that was the first example of electronic medical record transfer. And then in the 50s, a Canadian doctor built upon this technology and did like a teleradio system, radiology system. And he was using it to send more pictures. And it was the first film technology that really became what is now going to be telehealth in 1959. In 1959, the University of Nebraska established a two-way television connection, and that was to medical students across campus. And that's really the beginning. So it's like decades and decades of history when it comes to telehealth, which is something surprising to me because, I mean, telehealth as it is today is very advanced. And then just to see what the beginnings were, and it's very much related to film and photography, which is a big personal interest of mine. So this may be already obvious to y'all, and again, this is going back to me not skimping on any contents and being encompassing with the material. Introduction to telehealth, what it is, healthcare without an in-person office visit. It's conducted primarily online with an internet access to and with a computer, tablet, or smartphone. A lot of people talk about telemedicine as being telehealth. They're often used interchangeably, but also there are slight differences to both. Telemedicine is more of a subset of telehealth. Telemedicine is more specialized services and remote clinical services as well. So telehealth can be referred to as non-clinical services. So I know maybe some therapists engage in telehealth. I personally have my own therapist that I do telehealth with. I wake up early in the morning, I grab my cup of coffee, and I'm able to talk to my therapist like early in the morning, no big deal. I don't have to drive anywhere. It's really convenient. So this is just a very broad overview, and now we're going to go a little bit deeper. So like I was saying, this is just to outline the rest of the presentation. We're going to talk about telehealth as it is today, but then we're going to go into these subtopics. One is disability and telehealth. The second is telehealth and AT, being assistive technology. And then we're going to also talk about telehealth accessibility. So how we integrate all these things. And that's going to kind of be a theme of this presentation. There's going to be kind of a blending of all these topics together, but that's because they all inform each other as one system. So it's really good to think about it as one thing. When you adjust it, you're going to affect other things. And that's really how it should be, because between a patient and a provider, it's an ongoing dialogue, and it's always shifting and changing to the needs and wants of the patient, but also what the provider can do for that patient. And that also leads into my next topic, health literacy and advocacy, especially within patients. Just really being able to promote health as within education, making sure patients know what to do, how to do things during a telehealth visit, because we're not there with them. We're not there physically with them. We have to be able to coach them a little bit and also stand up for them. We do try to promote advocacy within the patient, but it also does help to have the provider provide the advocacy piece. It really does go far, and it helps make patients feel seen. And then finally, I'm going to provide some provider resources in case you are a provider that's not engaging in telehealth but would like to get started. So this is the state of telehealth today, just a broad overview. Why are we here? Why is telehealth a thing? So some of the challenges that we saw, especially during the pandemic, telehealth became a huge thing. Again, like I mentioned, it was already a thing prior, but it really boomed in popularity and usage during the pandemic for obvious reasons. We weren't able to go outside and access in-person services. This was largely because we didn't want to spread the virus and we didn't want to come in contact with people. It was unfortunate that we had to be remote and we had to stay away from interacting within our community, but it was necessary from a public health standpoint. But also, once telehealth got started, not everyone had access to it. Internet access in rural communities and economically disadvantaged communities weren't and still aren't able to access this service. It's a beautiful service, and I'll talk about why. But again, it's something that's not, it's almost a privilege, I would say, for most folks, because it's not always accessed by the folks that are the hardest to reach and that could utilize it greatly. So finally, I need not say the last part too much, but health outcomes were negatively affected when healthcare support was most needed. Again, highlighting the gaps that were highlighted during the pandemic. They still are there, they're still present. We're working on them. We're all trying to work together. But in terms of telehealth, that is one place that we can go a little bit above and beyond and further to providing healthcare to our hardest to reach. All right, let's talk about some positives. So telehealth, just blanketed, it enables access. It really, again, getting to the rural parts of the United States, especially here in Texas, it's a big state. There are a lot of places in the United States that are what we consider resource deserts. And what I mean by resource deserts, access to high-speed internet access, healthcare facilities are few and far between, even as simple as quality grocery stores. These are places where you can't get the things you need to live independently and live and flourish within your own community. So telehealth helps that by bridging that health gap for folks that are living in Wyoming or in the middle of Texas or even East Texas, and even places where people just can't access resources. And that could be even down the road, even here in Austin. Like there's a great many ways you can utilize telehealth. And that's why it's become so popular, because many types of professionals can offer services, no transportation, potentially shorter wait times between appointments, and then again, less exposure to diseases, communicable diseases like COVID-19, and then diminishes the urban-rural divide, like I was talking about, just really that gap in healthcare. Again, inclusive care, I'll talk about that a little bit, just like the idea of pay parity, that people pay for the same services as they would if they were to go get an in-person visit for telehealth. So the quality of care doesn't diminish between in-person visits and telehealth visits. That is what laws and regulations are set up, and what hopefully providers are trying to do for patients to bridge that gap again. And then finally, it's more economically viable for people, which is a big benefit for not just persons with disabilities, but for everyone. So talking about some negatives, because we got to take the good with the bad. It's inaccessible, like again mentioned, for many. There's a lot of preparation that's needed for patients and providers to be knowledgeable about telehealth and how it integrates to not just the provider, but the patient's life. It's inconsistent, just like with all technologies. It's hit or miss. It can have mishaps and things go awry. And then also during the pandemic, there was a boom in equity and subsidy programs that help fund broadband access and telehealth services, but those have kind of waned or even have run out of funding completely since the COVID public health emergency has ended for COVID-19 and the pandemic. So it's really, it puts folks in a tough spot. Personally, the Affordable Connectivity Program was a program that I utilized. It was a federal program that helped subsidize internet monthly payments. I saved about $20 on a $70 bill for internet services every month. And that actually, I mean, $20 is maybe not a lot to somebody, but for me, it's quite a significant amount. So yeah, just talking about resources and programs that have come and gone, but there are new ones that are coming out. And then finally, reluctance to adopt. I included this last one because not everyone, and when they do have access to it, not everyone wants to utilize it. They would still prefer an in-person visit, and that's okay. But it does really take like everyone to come together and look at all the options that are available and see what is best, what the patient thinks is in their best interests. And I just want to have in my notes that a more recent study was done in June of 2020, where it showed 58% of veterans care was provided virtually. but with the majority of these being mental or primary care encounters. But they also found adults that were 45 ages or older were less likely to use telehealth, showing some generational gaps between folks that want to utilize it and folks that don't want to touch it at all. It's something to keep in mind as with your populations and the people that you're coming in contact with, and just trying to cater that healthcare experience to the individual. All right. So talking about broadband access, this is just this is the Texas Digital Opportunity Hub. And then this looks at access to high-speed internet within households across Texas. It's a really amazing site. I really encourage everyone to check it out. There's some really wonderful statistics. But this is just one I wanted to highlight and why it really matters for folks to try to provide telehealth services in hardest to reach areas. Because if you look at this, we see mostly it's looking at heat map. It's a heat map of households that have adopted high-speed internet. Most of the households that haven't adopted the high-speed internet are in East Texas, and some in like West Texas. So more rural areas. All the metro areas you see in Dallas, San Antonio, Austin, Houston, Corpus Christi, all these places have a decent amount of coverage when it comes to broadband access, or folks that are utilizing broadband access within their homes. So a third of Texans households are not utilizing high-speed internet. And we're the second largest state in the entire United States. That's a huge gap. I know there are opportunities that are coming down the pipeline in terms of getting funding to broadband access in Texas, but it's still, as of this moment, an immediate gap when it comes to healthcare services. And then just to really nail away at this idea of providing telehealth services to the hardest of reach, this was done by the Southern Rural Black Women's Initiative in partnership with the local self-reliance community broadband networks. And what it looked at was providing 10 counties in what they consider the Black Belt of Alabama, Georgia, and Mississippi, providing telehealth services. And what they found was that there would be a return of 43 million per year accessing telehealth services. And that's in terms of like preventative healthcare and just overall just getting telehealth services to the hardest of reach. Accessing quality healthcare and preventive-based healthcare, a fifth of adults aren't able to access these kind of services, and they did this in more rural parts of Alabama, Georgia, and Mississippi. And this is just the impact that they found. I really recommend this article. It's a really great article highlighting the need for health equity and how telehealth can help with that. All right, so I'm not going to go too much into detail about this one because it's pretty deep dive. A lot of my notes, there's more details. But this is just current legislation around telehealth for the fiscal year 2025 budget. President Biden, the administration, wants to include $38 million for HRSA, which is the federal program for administering telehealth. For the National Cancer Institute, they want to do telehealth services with them as well. But still, they're trying to invert millions and millions of dollars into telehealth infrastructure throughout the United States. So there is funding available. So if you want, as a provider, to find out about these services, I strongly encourage you to go to HRSA.gov to figure out more, to find out more information, and also CMS.gov to see how you, as a provider, provide services and can qualify people, especially if they're using Medicaid or Medicare. All right, so we're going to talk about disabilities and telehealth. So understanding disabilities and telehealth, just talking about the pandemic, 40% of people, persons with disabilities used it during the pandemic. Many differences in usage were based on education, demographic traits, insurance status, and type of disability. And I think this last statistic is really revealing that 70% of patients with visually impaired impairments tried to use telemedicine, but only 57 of them reported problems accessing their appointments. So majority of folks that had visual impairments were trying to use telehealth, and the majority of them could not or found problems within their telehealth services. This is just a huge gap. And this isn't, I mean, aside from this one disability, we're going to see that other disabilities encountered similar issues. And then finally, it should be mentioned that American Indian populations experience increased disparities than other populations. And towards the end here, I include my notes and my resources and my citations. So yeah, telehealth best practices. So just overall, there's a gap when it comes to folks with disabilities and accessing telehealth services. So this is just to put that out there. Best practices for inclusivity and accessibility. Laws and advocacy really go far, really putting the power in the patient and making sure that they feel seen and respected and heard. That really goes, it's free to give those kinds of qualities and to imbue that into a provider and patient relationship. It's free to do, but it really goes super far for making your patient feel valued. Another topic that we'll get into later, two topics that we'll get into later, universal design for learning, and then also core, which is perceivable, operable, understandable, and robust. These are just principles when it comes to digital access and computer access and web content access. I'll go into more about that later. Also just analyzing the barriers and inequities when it comes to folks. Individualized problems are their problems, and it really, that's the kind of the lens we should see things. People don't live in a vacuum. They're always affected by what you do to them, and how we interact with each other really does have an impact on them. So analyzing how this person's situation is either going well for them or not going well for them, and how and what, trying to think of it as not a victim or of them as a victim, or putting the problem on them and making them feel like they're the problem. I think that really goes a long way. So other people would say solutions-based therapies, but yeah, just being more solution-based, I think is really, really amazing when it comes to that patient-provider relationship. Having a plan B, C, and D. I excluded the plan A because the assumption that plan A did not work out so well. Really having a backup plan to everything is key to telehealth, excellency in telehealth. Also, asking the patient and the community, again, I mentioned engaging them, asking them questions, and then also acceptance of telehealth. If you feel like this would be a best option for them, but they're reluctant, maybe be a little more hand-holding in the process. Just be a little more like dedicated and intentional with them, and ask them and kind of show them throughout the process, and also provide them resources. So during sessions, when you do have a telehealth appointment, it need not be said. We're always professional in our day in and day out. I got my collared shirt on right now, but you want to have proper attire and attitude. We're in Zoom rooms all day. We try to adapt and adjust to the digital online space as it's evolving very fast. So we want to just be mindful that we are online all the time, and that we should try to have a good attitude about it, even though it's it can be a slog to just be online and at your desk all day, but engaging with people via telehealth can actually be a really fun experience. Also arrive early, test your equipment. That's a pretty self-explanatory. You never know what's going to happen. Technology mishaps, like I said, having patience for that, because it's a natural occurrence that will go super far, especially with your patient. And then settings, you want audio and video off upon joining, just to make sure that your system and your environment is appropriate for a telehealth appointment. And then also look at the camera angle. All these things are pretty self-explanatory, but it should be said. All right. And then just when we think we know everything, we should always try to take a step back before we take a step forward. And then these really deal with having a certain cultural humility and being more tolerant and having more compassion within the healthcare space, but also just within yourself. These trainings, these are just some suggestive trainings, just being more aware of disabilities, testing out assistive technology, learning a little bit more, And then just overall, just trying to, when you think you know something, try to curb the ego and then try to like just understand that we don't know everything and we're always a student of life and we're trying to learn and that our patients can teach us something. And then I just want to mention Harvard University has this project implicit. It's a really wonderful program, quiz that you can take to see where your biases are. When you think you know something, think again. It's to highlight kind of where you have biases within yourself and your beliefs. And it's not something to self-judge yourself about. It's just a way to kind of think about in what ways has the world constructed my viewpoint. And it's really a great tool for deconstructing certain viewpoints and learning new things. So I do think it has racial, ethnic, and cultural considerations, which we always need because we're in a very diverse country and we're engaging with patients from all parts of the world. And finally, trust, empathy, respect, and compassion. I want all those things. So I told us we were going to talk about different disabilities as it relates to telehealth. 42% of folks with cognitive disabilities try to use telehealth during the pandemic. A wide range of AT was used by persons with cognitive disabilities, and they can all differ. And then people with intellectual disabilities will need more time to learn skills and necessary things to use new technologies. So just this being said, people use this with cognitive disabilities during the pandemic. They use telehealth. And it does take a certain, again, a compassionate provider to meet them halfway. And certain examples of that is if they're using a AT device, a communication device, for example, sometimes that device needs time to process or they need time to process typing and putting in input into their communication device. This can be, I would say, a very slower, more intimate process. And I think it's something to consider as you're giving telehealth services. It might take a little bit longer to communicate with somebody. People communicate fast, some people communicate slow, and some people communicate in the middle. We're all over the place, and we should be accepting of all those things. And it's not bad or good. It's just how we communicate. And I think if we have a little more tolerance, just engaging with people and taking our time, we'll have a really great experience within telehealth. In my notes, I have a little bit more detailing about cognitive disabilities and how it relates to telehealth. So please take a look. Talking about mobility disabilities, also used in telehealth. That was used by disability type of 43% of people with mobility disabilities use telehealth during the pandemic. A wide range of AT is used by persons with differing physical disabilities, and providing individualized, tailored telehealth promotion programs to a person's unique needs, interests, and comprehension skills holds promise for promoting a great chance of long-term sustainability. So once everyone is educated and trained and informed on all types of disabilities, from a cultural standpoint, because how disabilities are seen in different cultures differs too. So it's everything is nuanced, and I keep nailing the head of the nail that like people are very different. Individualized care is always needed. I know this may be again obvious, but it does make it a big difference. I myself have diabetes, and I can't tell you how many times where I've been in a doctor's office and felt not necessarily seen or heard because of my individual needs during an appointment, and just like how I differ as a diabetic. I'm not the same. I have differing preferences and wants. So in here, I talk a little bit more about tailoring health promotion to folks, especially for folks with mobility disabilities. So please take a look. All right. So assistive technology to support ID, DD, brain injuries, and dementia. There are many tools that help with this. Some of which are text-to-speech, plain language, and easy read text, which I'll kind of talk about how you can achieve that later on. You want to support executive functioning tasks with like setting an agenda, letting your patient know ahead of time, like this is what to expect and this is what we're going to talk about. That really goes far. I can't tell you how many times I've gone into a meeting not knowing what to expect and feeling nervous or anxious and kind of scared and just like don't know what to expect. And it really helps when I can have an agenda in front of me and I can kind of plan a little bit around that. Um, Calendar, task minder management, just reminders in general, medication management, especially for folks that may have, I mean, we live in an attention economy, but ADHD or some attention related disorder, like ADHD. I personally think I have undiagnosed ADHD, but that's another topic. I forget sometimes to do my medication. It's just something that if you have notifications, it goes really far away, or it goes far so far as keeping up to date with patients' medication management. And then again, reminders, monitoring, and then even geofencing location management also can be a big boost for folks within this population. All right, so I was talking about ACC, augmentative communication devices, alternative and augmentative communication. So there's low tech. These are really useful during disaster related events, especially if you're engaging folks that don't have their communication device with them, their high tech communication device. There are such things as like picture boards or spelling out that are really, really beneficial. And especially if you're doing telehealth services, if you need a physical representation of something, it's a great tool to communicate with folks online. And we can provide pictures. I can provide more additional info about the ATs, the assistive technologies that we have in our loan library. Another high-tech device is, again, an AAC device that is electronic, that is, folks can use synthesize or digitize speech, especially with AI. It's becoming more and more being able to synthesize speech and to bridge that gap in communication, which is really great. But again, there might be delays in communication with their devices. So again, I want to stress that patience is really valued, especially in this space, because it may take time to process and say what they would like. So it's always good to just take a minute, relax, don't avert your gaze or don't like look at your phone or anything. Give them the time and attention and care that they want and that they deserve. So looking at them, directly at them, and just waiting patiently, it makes the difference. It makes the world's difference. And people might use part-time AAC. So it's always good to just, if they do have AAC, but they don't use it all the time, but just ask them and see if they might not use it all the time because they find more often than not that it doesn't integrate well with the systems that we work with, like our phones, tablets, and computers. And they're dissuaded from actually using it within their everyday life, but it does enhance their everyday life tremendously. So if you're able to try to work with them and try to integrate it, it would really be a big benefit to them. So like I was saying, it may take them a little bit longer to generate messages. So just wait. All right, so for sensory impairments, assistive technology, there's visual, hearing. These are very generalized aspects that you'll find within disability spaces and accessibility. Screen readers, text-to-speech, visual descriptions, logical navigation, color contrasting, within hearing, closed captioning, transcripts, sign language interpretation, because we might have patients that don't have English as their first language, or that can't speak at all. Or hear it all, sorry. This is really, you want to try to think about what can amplify and enhance their experience in telehealth. I have the White Cane program highlighted here. It's a program that allows folks with visual impairments to travel independently and safely. So anyone that's blind or has any kind of visual impairment shouldn't be without one. And there are programs that offer free White Canes to folks. So please check it out. All right, so just for physical access in general, that may be your home environment, that may be your office environment, that may be just public spaces. These are just a few things that help with daily living skills and promote independence in your day in and day out. So a lot of it's alternative access for computers, tablets, and phones, alternative keyboards. All of this we have in our loan library, and I'll get to that link and what our loan library is in a bit. But they're all available, and please check them out. So I have my alternative mice, joysticks, trackballs. We have some eye gaze technologies as well, voice control, speech to text. A lot of those things are built into your everyday tablet, phone, computer, phone, right, smartphone. And we'll go into that a little bit too. So electronic medication reminders, I mentioned that before, and then modified desk workstations, like if you want a standing desk, and adjustable tables. All right, so I kind of talked about disabilities and AT and what would be needed for just accessing telehealth, but there's certain things within the digital sphere that help with accessibility and telehealth, and they're when you do integrate their devices, just kind of streamlining the whole process. So I'm not going to go too much into detail over these, but these are the laws that govern accessibility and make sure that accessibility within healthcare settings, within educational settings, within workplace settings are all compliant. In 2010, President Obama signed the 21st Century Communications and Video Accessibility Act into law that updates federal communications laws to increase the access of persons with disabilities to modern communications. The CBAA makes sure that accessibility laws enacted in the 80s and 90s are brought up to date within 21st century technologies. And even in the future, they are supposed to be updated, including new digital, broadband, and mobile innovations as well. So take a look at all these other ones if you would like. And in my notes, I have other details. So we're going to talk more about technologies that we all use and we get into every day, like our phones and our tablets and our computers. So accessibility within our everyday devices, not assistive technology necessarily, but they are assistive technology tools. This is just a few things from the big giant companies that are around us all the time. So Microsoft, Apple, and Google. These are, again, things I mentioned prior that are kind of general aspects and tools that you can find within all three companies and their devices. So like an immersive reader, a narrator, translator, dictation, live captions, you'll find a tool that's very similar or exactly like that within all three, like Microsoft, Apple, and Google. All their devices will have something like that. Some of them are more specific, like assistive touch within Apple Watch. And then the magnifier and point to speak is an Apple feature. So it's something that there are some slight differences, but they're all very much the same and do very much the same things. And they're all built into our phones. Oop. All right. So I'm going to stop talking for a second. I'm going to take a drink of my tea. We're going to pull out our phones for a second, and we're just going to kind of play around with our accessibility settings. So what I would like all of us to do is to grab our phones, pull them out, and then especially if you have an iPhone, what you want to do is you want to go to settings and you want to search for accessibility. And then you want to see what kind of features and functions you pull up. And then please in the chat, if you don't mind, just letting me know if you found out something new, found out something exciting, you found out something that you didn't know. So yeah, I'm going to drink my tea and then I will also do my accessibility stuff. So the first things I do when I go into my accessibility settings, I see right at the top voiceover. I can do some zoom features. I can change text size. I can have more spoken content in different languages. I can get audio descriptions of certain things. And they have them all broken down by different types of disabilities or different aspects. So vision, one is physical and motor. functioning, and then one is hearing, one's related to speech, and then they just have a general accessibility block as well. So you can get stuff like live captions, you can sync up your hearing devices to them. You can have something that's an assistive access and guided access. Obviously, Siri is I would say, a kind of an assistive tool. It may not be on the surface an assistive technology, but all these assistants like Alexa, the Echo, all these home speakers and smart devices, they all have some sort of assistive tool and a feature about them. So while not explicitly AT, it's fairly, you could say it's an assistive tool in some regard. So let's see if I can pull up the chat. Okay. So Angela says, my favorite Android feature is Live Scribe that transcribes speech to text in real time, and I can save it. Oh yeah. And so you can just like, even when you do your doctor's notes, you can have them, it's almost like Otter AI or something. Or if you want to just like say out your grocery list, you can just like, I need to buy a bushel of bananas. I need to get some cabbage. Any SS, X, Y, and Z. Cole says assistive technology is really a great tool for folks with limited reach and dexterity. Thank you. Oh, Angela says the feature is Live Scribe. Perfect. Cool. All right, so I'm going to move on for the sake of time. All right, so looking at this is the National Center on Accessible Educational Materials and CAS. So these are mostly features that are geared towards the educational setting, but I wanted to bring them in because they are just general best practices for digital content accessibility and making sure that your websites and all of your digital content that you put out to the public is accessible. It's accessible by your patients, by the public in every way that can be read by an assistive technology. That is just, again, what I'll talk about as those principles. I'll get into them a little bit later. But again, these are just things as a provider to think about when it comes to your HIPAA compliant documentation, just making sure that medical jargon is broken down in ways that the reading level is consistent for your patients, because they all have different reading levels and comprehensions as it relates to medical terminology. So you want to make sure that they're able to understand the stuff that's being told to them. Readability, making sure color contrasting, all these accessibility features that really go far for folks that may have a visual impairment or that don't understand or have a cognitive impairment. It's just making sure that it's readable documentation. Or logical order for navigation, text speech, alt text, all these things really contribute to a robust content and product. And I have more in the notes here if you'd like to dive into accessible materials. And please go to these websites to test out your materials and see if they are accessible. So talking about POUR, going back to the beginning of the presentation, I was talking about this acronym POUR. So this has been designed by them, by CAST and everyone, to be perceivable, to have your content be perceivable, which is content that will make it possible for all your learners to see and hear the information. Operable, making sure all your learners are able to navigate the information independently using the preferred tools. Again, understandable, going back to that reading level, making sure the content will support your learners' understanding through a consistent, predictable design. I like that word consistent, being consistent with your patients, especially when it comes to expectations, setting goals, that really goes far for health outcomes. And then finally, robust. Content that will work for your learners on a range of current and future technologies. So again, being accessible, being able to be accessed by all technologies and devices, and in terms of telehealth, from any part of the world. So these are good principles to follow just in digital spaces in general. And then you're probably wondering, like, how do I make my documentation more accessible? Am I following compliance? Please check out these sites. AIM Center is really great for using an accessibility checker. So you want to see if your websites are accessible, especially if people are using their online websites for scheduling and their portals. Sometimes those portals are clunky. Sometimes those websites aren't necessarily clear. Um, uh, what is I've been redesigning the website for our center, and just logical navigation and just pathways to accessing content are incredibly nuanced. And the term escapes me, but it's just thinking about that UX, the UX design, the website design, and how things are structured and laid out really sends a message to your audience, especially your patients. And if things are weird and confusing, it can really cause anxiety and also just discord within health as it relates to our patients. So these are just great resources for making sure that your content is well organized, all the principles: receivable, operable, understandable, robust. So I think it needs to be mentioned because I am a big promoter of making sure content is accessible in other languages. Um, this is an endeavor put out by the government. The Office of Civil Rights from HHS and the DOJ's Civil Rights Division. They explain how federal laws have made it compliant, have made people that provide healthcare, especially for telehealth, have to be compliant to providing limited resources for limited efficient persons, especially if they can't access material and understand the material in their own language too, like making sure the reading level, for example, in Spanish, if it has to be at a lower reading level or at a higher reading level, just making sure people understand in their own native language is very not only vital for health outcomes, but just making sure that that cultural humility piece I was mentioning earlier. So digital services involving the electronic delivery of information, including data and content across multiple platforms and devices, such as text, audio, video, mobile applications, and graphics are transmitted for viewing over the internet. You have to make sure that all of this content is accessible to your other people. And I know, or to your other communities that don't speak English. I know that's really difficult to do, but there are people and places that can help you with that. And if you just like rely on who you know, you can really get far so far as accessing communities in ways that is spoken and understood in their language and their understanding of the world. So these are more, this is not a hot link, it's a PDF. So it potentially could go away after a while. So I encourage people to go to this site, download this PDF if you are a person that does engage in telehealth and telephone appointments and you need an interpreter. More often than not, I've heard interpretations are not the best way to go about communicating with other people or communicating with people in other languages, because I don't know if people have seen the movie Lost in Translation. While that doesn't have anything to do with healthcare, just the idea of things being lost in translation, the information that's really vital to health outcomes can be lost. So I really do think as a provider, we need to look at a little bit inward and ask ourselves, am I the best person to serve this patient? If I don't speak Spanish and I have somebody that is Spanish speaking, it would be, for me, at least my thought is, to have interpretation is not to do them justice. To have a provider that is identifies with them, whether it be by culturally, whether it be race, or just within language. If you can speak the same language as your patient, it benefits everyone. So this is just something that it's not perfect, but you can utilize it if you need to. So this is a guide that they put out for telephone interpretation if things are going well or if things are going bad. And this leads me to my last topic. So it's kind of been itching at the idea of advocating for your patients and making sure that they're put in the best place possible and that they know what they're being told. So how do we promote health literacy and telehealth advocacy within our patients? How do we convince them that telehealth is a great option and that you can learn a lot from it and you can have the same quality of care as an in-person office visit? It's a challenge for all consumers. I think that's a key part, is that we're all trying to learn. We're all trying to understand this crazy landscape that is healthcare, because it's not a straightforward process. It can be hit or miss, and not everyone has the same equitable experience. So this is put out by the Office of Disease Prevention and Health Promotion. It's a guide for simplifying the user experience. So for our patients, what we know about the users with limited literacy skills. You can write actionable content. You can display content clearly on the page. You can organize content and simplify navigation, engage the users, and also test your site with users and limited literacy skills. So this is a guide, essentially. It's a research based in research that will help you develop intuitive healthcare websites and digital tools that can be easily accessed and understood by all users. So in combination with those core principles, you can utilize this guide as well to make sure that all of your health content is accessible and understood by all patients. So yeah, I have the website for that in the notes. So I've kind of talked about this too much, not too much. It could be talked about forever and ever and ever. It always starts with a discussion. Do they currently use AT? Is it a good option? Is it the best option? What are their experiences? Really just kind of creating a story, creating a dialogue is the first place with your patients. Try it out and be open to change. People may have to adjust, whether it's on the patient or the provider side. We got to figure out what's the best situation for both parties. And like I said, plan B, C, D, and sometimes even a plan E. And then this one, and the other side is, I think, surveying and getting feedback and reading reviews, kind of doing that self-check and kind of maintenance, just making sure that we're being informed and aware, and also just not harming our patients. That's not, I mean, we can unintentionally harm people. That happens all the time when we don't think about it. But if we're intentional and we pay attention, we can really do well by our patients. So put yourself in your patient's shoes. What did they need for the appointment to go well? How can things fail within this system of telehealth from the patient and provider side? And then there's a variety of all these platforms and technologies and softwares out there. So it really takes a kind of a bridging of understanding and also a willingness to learn new things. So finding the best solution. Like I've said, just survey them, talk to them. That's what we want. We want the best solution for our patients. So, is there anything? Yeah. And then this one I want to spend just a little bit of time on. It's talking about best practices for humane use of technology. So this is the Foundations of Humane Technology. They're a nonprofit, and what they do is they talk about injecting humility and humanity into our technologies, and trying to remind ourselves of who we are first before we start integrating within technologies. Especially as it relates to our younger generations and our future generations, how technology is affecting them, how AI is affecting us, our mental health, our attention spans. This company really talks about how we should take a step back before we take a step forward as it relates to technology and the ever rapid development of technology. We can sometimes get negative side effects. There's a lot of benefits to technology. There are a lot of negative side effects. Undue stress, undue anxiety, more social isolation, more loneliness. And I think it just needs to be said in any kind of sphere that relates to technology. We want to think about who we are as people and as individuals before we start integrating and communicating with technologies. They are great tools, but they also have consequences if used poorly or incorrectly or used to harm themselves or others. So it's something to consider as we move forward in the digital landscape and digital spheres. And so this is just, they have courses, they have workshops. Please go to this website. I really encourage people to. It's a great little website to think about. They talk about everything. Like I have here, future privacy and safety, democratic functioning, information environment, how you pull in information. They talk about misinformation, how that is prevalent in our world and day out. And we need to think about how we discern and how we break down information and how we understand it. and what it does for us. So please take a look at this site. And also, so we're getting to the home stretch. This is just an example of a provider-assisted telehealth physical exam. Watch this video. It's a really great one done by Stanford Medical. It was a really robust engagement, and just kind of showing a more softer and slower process to really making sure you're engaging your patient in an excellent way. So I really recommend this video. We don't have time to watch it, but please go check it out. All right, so I can't continue onward without putting a plug in for our telehealth kits that we have at the Texas Technology Access Program. So these are smart kits. It's a smart collaboration between the Capital Area Council on Governments and us. So within these kits, you can tell your patients to go to our website. They can check out these kits. It's a 35-day loan device. And what they do is we give you all the materials to send it to you, and we give you all the materials to send it back. It's free of charge. Anyone in Texas can access it. We don't check insurances. We don't check citizenship. You just have to be living in Texas to utilize our services. And every state in the United States and the territories has an AT program. So please, if you're in some other state or you know somebody in some other state that can utilize a program like this, there is one. So please go check them out. But for the sake of us, if you have patients that want to engage in telehealth, but are kind of like, where do I start? What technologies do I use? This is a great baseline. So within these kits, you'll find smart plugins, you'll find smart lights. So they're called Samsung Hue lights, and they turn it on and off without a switch. And you can also put timers on them. We have Ring cameras and doorbells, so you know who is coming to your door. This is especially great for folks that have dementia. They're able to recognize somebody that may be of recognition or not before they open the door. Also, we have a smart speaker, Amazon Echo. These assistive devices can really help with daily living skills and setting task management. And then finally, an iPad, an Apple iPad. So you need a communication device to actually have the telehealth appointment, and that's why we have the iPad. But we also include a few health devices as well. So we include a distance thermometer. We have a blood pressure cuff, an oximeter, so measure oxygen in your blood, and then also an EKG, cardiomobile tool. So to detect rhythms of your heartbeat. And these, I think, are the best parts of the telehealth toolkit because they promote health literacy within your patients by having them do a routine checkup, and you'll coach them through the process of doing a routine checkup and just checking their vitals and making sure that they just know how to do the basic body scanning and checking to see if certain things hurt or don't hurt or that they're doing things correctly. I think everyone should have the basics down for doing some sort of like body scan and being able to measure certain vitals of your body. Especially even if you're feeling good and healthy, it's always good to be able to do a checkup once in a while. So you see, we have our QR codes. We have the links right in the slides. Again, you can go to these, you can scan these and check them out at our loan library. So like I was saying, accessing our telehealth loan library. This is a huge, robust loan library of assistive technologies that we have here at the Texas Technology Access Program. Please check them out. Again, 35 days. It's a try before you buy system. We serve almost all disabilities from twinkle to wrinkle. So please check it out. This is a video that explains how to check out our devices and search our library. All right, so let's get to the review part. I'm almost at an hour, so I want to get to the home stretch. What do we need to be excellent providers of telehealth? Some disability and cultural sensitivity and humility. Again, it goes a really long way with having imbuing that sense of respect in your patient. Ask your patients. Having the compassion and desire to learn new things and new technologies. Advocate for your patients and for others. If they need to be in a better situation or they need a different provider, then let's get them the best provider possible. And then taking feedback and refining approach, kind of like taking that ego, putting it aside, I know we spent years in our professional spaces, and we are experts in our fields, but sometimes our patients can remind us that we don't know every little nuanced aspect of human existence. People are very individual and have very specific needs and wants. So let's just talk to them. And then also educating patients. So apart from educating yourself, educating our patients on how to do body scanning, how to use assistive technology and using telehealth. It's very much all systems inform each other. And that's what I meant about this content will be kind of blended because everything is all one together, kind of like a moving system. It all flows together and kind of ebbs and flows with different cause and effect. So it's that relationship with the patient. So it's a great tool, telehealth, and it has limitless potential for the future. Again, with health equity, it can increase it. It can connect communities that have limited access to broadband and health services. And then again, promoting health literacy. So these are some Texas telehealth provider resources. I got dishes on here. I got the Texas Louisiana Telehealth Resource Center. They are the regional center here for HRSA. Please check them out. They are the best place to go aside from the Texas and also the Texas Medical Association. Those are going to be your best two for being a provider that wants to get started or that has a question about billing and all that. The Texas Medical Association and TextLaw can definitely help you with those two things. And us, please check out us. We're happy to help you. And when it comes to Medicaid and telehealth, you definitely want to go to cms.gov, but also there's the Texas Medicaid and Healthcare Partnership. So they're contractors and providers may provide telehealth communication services with their MPI number. So you want to check all these things out when it comes to enrollment, especially for folks that are on Medicaid. Some national resources. I'm not going to go into too many details because we're out of time. More talking about the telehealth resource centers that HRSA's put out. They're all divided regionally. So you see in the different colors. They telehealth resource centers, they have digital navigation toolkits for providers and patients. And so you'll be able to connect with others and learn from these toolkits, especially if you have patients that don't know what to do. These are really easy to navigate toolkits that are available based on each region. So please check them out. Some more resources as it relates to veterans, as it relates to Spanish speaking, as it relates to broadband access in rural areas, rural health information, just kind of everything that could apply to telehealth I kind of threw in here. And all of them are great resources, even if they don't pertain to Texas, like the California Telehealth Resource Network or Center. Great telehealth center. And that's also a TRC as well. So finally, the last slide of telehealth, national telehealth resources. So I have a resource for Spanish speaking households at the bottom, Family Voices National. It's a curriculum like telehealth curriculum in Spanish and some other ones. Questions, comments? We are at the end of the presentation. So I'm a little bit over time over that hour that I promised. So I do apologize if folks are needing to get to other things, but thank you for being here today. Use this QR code, use this Qualtrics link to tell me how I did to evaluate the content. Was it some content that you found new? Was it some content that you already knew? You're able to answer that in the Qualtrics. Let us know if there's any other topics you'd like us to present on or you would like us to talk more about. It's really great to have you all here, and I really appreciate you being here. And yeah, I'm happy to engage people with questions and comments and stories because I've been talking at you for an hour or so. And I know that there's another side to that story as being a provider. I'm not a provider myself. So I don't know how it's been. I don't know your experiences. I don't know how patients have had. I only know my own personal experience. So if you feel like things are being done well in telehealth spaces, I'm only talking from the perspective of persons with disabilities, and that viewpoint that is very critical and important within healthcare settings. So again, I don't know what is going on, and I would love to engage folks and have a discussion about what your experiences have been within telehealth. So I'll pull this slide up again. I'll put the Qualtrics link in the chat, but I just want to say thank you so much. And yeah, that's my presentation. Thanks, Cole. All right, I'm going to go ahead and pause the recording now.